Welcome back. You're still watching Maxi Health, where your health comes first, and this is the Ask Your Doctor segment of the program. On Ask Your Doctor segment, what we do is we give you replies to the text messages and emails you've sent to us during the week. And my very first question for this week says, okay, if your husband married you as a virgin, your husband has to disflower you also, basically, for you to be able to achieve pregnancy. So, of course, you can't get pregnant without being disflowered. You really need to be disflowered. So once you're disflowered, then you can achieve pregnancy easily. So that needs to be done for you to achieve pregnancy. I wish you all the best. You are perfectly okay. The only reason why you're experiencing that pain at your left side, like you have said, is as a result of your sign of ovulation. Particularly, you said it comes after your menses. So most people might be experiencing at their left side, some at their right-hand side. It depends. If it's coming immediately after your menstruation, then automatically what you're experiencing is a symptom of ovulation. And for some women also, it alternates for them. Some women experience that their left side, some women experience that their right side. Particularly if in a month you experience it at your left side this month, in another coming months, you might experience it again at your right-hand side. While some constantly experience it at a particular side of their ovary. At that particular time, your eggs or the follicle are being released from the ovary. So basically, you are fine. What you're experiencing is a sign of ovulation. Alright, basically, when you look at that question, there isn't much wrong with you, but I would advise you to run an hormonal profile test. I would advise you to run an hormonal profile test, and at the same time run a culture test, then you now see a doctor with your test results. Okay, if you experience itching at your private area, and you said you have maybe white discharge coming out from your private area, the fact that the discharge is white, I would say you are fine. But because you say you itch, then probably there must be something wrong somewhere. But you didn't tell us whether you're a lady or you're a guy. But if you're a lady, I would advise you to run a swab culture test. And if you're a guy, you also run a culture test too. You can use your semen culture basically to run the culture test, and then you see your doctor with these test results. As a lady, when you're experiencing painful menstruation, for a lot of women, some women experience painful menstruation maybe after their childbirth, while some experience it even before their childbirth. It depends on how severe the pain is. If the pain is something that you know you can endure, then what I would just advise you to do is you could just get a pain reliever, then you use, and then you are fine. But if you find out that even after taking this pain reliever, you're still undergoing a lot of pains, I would advise you to please do what? See your doctor for more medical advice. Staphylococcus is not a toilet infection. It is a bacterial infection, but we can come in contact with staphylococcus infection from the toilets. Apart from even sexual intercourse, another way by which you can contact staph infection is from the toilet. So it's not a toilet infection, it's a bacterial infection, but you can contact it from the toilet. Yeah, if you need a baby, number one, I'm sure you're married, because first and foremost, you must have a partner and you must be married for you to have a baby. Fine, okay, now assuming you're married and then you've been trying to have a baby for some time now, and then yet the pregnancy is not coming forward, then the next thing for you to do is to see a gynecologist doctor. The medical test will be done on both yourself and your husband. So I wish you all the best. Alright, basically we don't prescribe drugs on air or on the program. But when you're talking of candida, candida is a toilet infection. Do you understand? So what you are having is you have a toilet infection, which is the candida albicans infection that you have. What I would advise you to do is, since you've already done a test and you know you have candida albicans infection, I would advise you to do what? Please see a medical expert as soon as possible, and then the right medications will be given to you, and then you have a good health. You have staphylococcus, and that's the reason why your semen is watery, you have quick ejaculation, you have premature ejaculation, and that's why you have not been able to pregnate your wife, because automatically even your semen counts will have been low. If you are diagnosed of a particular infection or a particular ailment 3 years back and you have not been able to treat it, I mean, that's too bad on your part, basically, honestly. And that's the reason why you have all those symptoms you have mentioned, the watery semen, the low sperm count, the premature ejaculation, and not the inability to be able to pregnate your wife. So please, what I advise you to do is you need to see your doctor as fast as possible and as soon as possible. Not just you, it has to be yourself and your wife, because the fact that you have this staphylococcus infection, automatically your wife also will have this staphylococcus infection also. So both of you should please do what? Go to the nearest hospital and visit a doctor as soon as possible. I wish you all the best. Yes, the fact is, because you are used to masturbation. Masturbation is not good at all, and then you need to take it off your mind. So that's why every time you need to ejaculate into your wife, you are not able to, because you're used to masturbating. When you masturbate, then that is when you are able to release, or ejaculate. Basically, I think you need more of medical advice. You don't need any drug or any treatment for that. It's just more of counseling. So I think I would advise you and or suggest to you that you please do what? Just please pick that number on the screen and give me a call. This is how much question we can take on today's segment of Ask Your Doctor. So far so good, we have come to the end of today's episode of Maxi Health, where your health comes first. Till I join you again, same time, same station next week, I say bye-bye.